Good morning. I'd like to call this joint meeting of the Board of Health and the Board of Commissioners to order for Tuesday, July 31st, 2018. And the first item on the Board of Health, Board of Commissioners meeting is adjustments to the agenda. Any adjustments to the agenda? Seeing none, we'll move on to public comments. And there are actually going to be two sets of public comments this morning. There's one for the Board of Health, and then there'll be one for the regular board meeting. So is there anyone signed up for the Board of Health? Thank you, Kathy. So with no public comment, we'll move on to Commissioners' response to public comments and or other issues and remonstrance for the Board of Health. Any remonstrance from the Commissioners? Commissioner Farr.
Not a remonstrance, but I like to carry this to the Board of Health meetings. You all know what that is? It's Girl Scout cookies in a bottle. You smoke them.
Any other remonstrance? Thank you, Kathy. If not, then we'll move on to emergency business for the Board of Health. Any emergency business?
No.
Then we'll move on to item 5A, which is a report on suicide in Lane County from 2000 to 2016. And we have Karen Gaffney, our Director of Health and Human Services, and Roger Brubaker, our Senior Community Health Analyst. So, Karen.
Good morning, Chair Bozovich and Commissioners. It's an honor to be here today to talk with you about this subject. I know we've spoken a number of times over the last year about the situation in Lane County related to suicides, and have told you as the Board of Health that we would be bringing you data and some recommendations related to that situation. And Roger Brubaker, who will do the bulk of our presentation today, has been working on this issue really nonstop for the last year. And as you know, while working on this report, we've simultaneously had to pause during that process a number of times to deal with suicide crises that were happening in our community. So I'm glad we were able to today bring you the data, be able to take the lens back a little bit and look at the situation in Lane County as a whole, and then talk with you about where we go from here in terms of addressing suicides in our community. It's a sad and tragic situation that I know each of us have some personal connection to. So thank you for taking the time this morning to have the conversation, and I very much appreciate Roger, who's done the work on this report and will continue to lead our prevention efforts into the future. So, Roger.
Great. Thanks, Karen. Morning. So today I'll be presenting a number of things about suicide in Lane County specifically. So I'm going to provide a brief overview for you about the Lane County Public Health Suicide Prevention Program, which I coordinate. We're going to be reviewing some of the findings from the first real comprehensive epidemiological analysis of suicide mortality right here in Lane County. And then I'll also be discussing some recommendations to prevent suicide in our county as well. So just to give you a quick overview of what we do already and how we see this issue and address it. So suicide is an incredibly complex social phenomenon. But it's largely preventable. One of the metaphors that we use to look at suicide and to think about the entire scope of the issue is this metaphor of a waterfall. So at the point of the waterfall is when we are thinking about a death by suicide. However, there are multiple opportunities before that moment to prevent and intervene with deaths by suicide. So our prevention program in public health takes this big comprehensive view to address some of those normal life circumstances and issues that I'll discuss further in a moment to prevent people who may be at risk 10, 20, 30, 40 years before they would ultimately die by suicide or attempt suicide. We also address issues that would, in terms of training, that would be able to help people who work in the medical sector, schools, or just in the community at large to identify and intervene at moments of potential crisis. And then also in our program, we work with community members and individuals after a death by suicide to include them in the community conversation and in how to prevent future deaths, but then also to promote healing and reduce risk after a death by suicide, because that is a critical moment. So our program does we have a number of activities that I provide community and school trainings, which Commissioner Farr actually had the opportunity to attend one. I provide technical consultation and policy development to schools, agencies, businesses to prevent and respond to suicide deaths. We do surveillance and analysis of suicide deaths and in the future attempts in Lane County. And also, like I shared earlier, postvention crisis response, and this is per Senate Bill 561, that requires us to assist communities and schools after an adolescent death by suicide, which I'll address as well. So from here on out, I'm going to focus on the findings of this report. But before I do so, I always think it's important when addressing the statistics around suicide to acknowledge the real impact of this topic, that it's not just about numbers, it's not just about data, these are people's lives. And so this is a pretty traumatic topic, and before I ever give any training or presentation about this topic, I always make sure that I acknowledge that and acknowledge the fact that this is a distressing topic, and that if what I share distresses anybody in the room, that it's okay to ask for help. Help is available and it's effective. I usually say I'm going to be the last person in the room, but I don't think that's going to be the case today. But if anyone has any questions afterwards, I want to make sure that they reach out to me and talk to me afterwards. I'd be more than happy to talk with you. Also, I really want to thank first responders and the ME's office who supplied the data for this project. And lastly, acknowledge lost survivors. This is essentially a record of their loss and that tragedy in our community. But hopefully it also provides a sense of guidance and hope moving forward as well, so we can address this topic more effectively. So to give you a picture, I think it's really important to start big, and then we can kind of narrow down. We have a very unique situation here in Lane County compared to the rest of the country. So some recent, if you take a look at the map here, some recent data that came out from the CDC demonstrates something that really highlights the need in Lane County. So to create what we would in epidemiology, what we would, if we're trying to create a stable rate for mortality, we need to have, it requires a certain number. Throughout the United States, at a county level, it is impossible to identify a stable and rate of death by suicide because there are less than 20 deaths in any particular county. So if you look at the map here, what this shows, all those white spots, those are all counties in which they have less than 20 deaths by suicide in any given year. So that's about roughly 85% of the country experiences that. Here in Lane County, on an annual basis, we have about 80 deaths per year. So what this suggests is that we have at least, on a county level, 4 times more death than by suicide than 85% of other counties in the country. When this statistic was brought to my attention, I found it to be a really powerful way to explain to people what occurs in our county and what Lane County as a whole needs to do to address it. So our county rate is slightly higher than the Oregon rate, which is itself about 50% greater than the national rate of death by suicide. So I just wanted to provide some of that context first so you could see where we're at here in Lane County. But from here on out, I'll just focus just on statistics related to Lane County. So between 2000 and 2016, 1,079 people have died by suicide in our county. 90% of those people were older than 25 years of age. So I think it's important to highlight that. We have had absolutely which I'll address in a moment, a tragedy of a suicide cluster among adolescents. But on a day-to-day basis, the vast majority of deaths by suicide are occurring in middle-aged and older adult populations. 1 in 4 people that die by suicide in our community was a veteran during this time. So that's a total of 234 veterans have died by suicide in our community in roughly the past 16 years. 77% of these folks were men, meaning that men are 4 more times likely to die by suicide compared to women. So I just have this box up here just to demonstrate that this is where the total burden of suicide in our community is. Now, rates of suicide really change as people age throughout the lifespan. So the maximum, so what you'll see here on the chart is the red line being men, the green line being just the average, and the blue line being women. As people age, the risk for death by suicide increases, and this reaches a maximum risk of death among older adult men. This risk constantly increases as men age. However, as women age, this risk actually decreases in older adult women. So what this means is that older adult men have nearly 3 times the risk of death by suicide compared to the general population, and they actually have 8 times the risk of death by suicide compared to women, older adult women as well. So this is not actually going to be part of the forthcoming report that will be published in August that will give a much larger view of this issue, but I felt it was important that we address it given recent events in our community. In terms of adolescent suicide, on average, Lane County has 7 adolescent deaths per year. This is 10% of all suicides.
Can you give the age of adolescent in this study?
Yeah, thank you. This is anyone who is 24 years and younger. This past year, as you all know, our county experienced what is known as a suicide point cluster. This is what that means is an abnormal or unexpected number of deaths by suicide in a given place and in a given time. So we had 5 Lane County adolescents that died by suicide in about a 2-month window between January and March. To date, currently, there have been 7 adolescent suicides this year. So suicide affects youth very differently. There's a much higher attempt rate among youth, making identification of those who may die by suicide very more difficult. There's a higher ideation rate. When I say ideation, I just mean serious thoughts of suicide. But however, like I shared, as the mortality data shows, this death among adolescents is relatively rare compared to older and middle-aged adults. But the impact is felt quite differently among youth because of that density within of a social network within schools and the possibility of what's known as contagion, suicide contagion, meaning that exposure to a death by suicide can spur further deaths by suicide. It's why we have our postvention response as a state and as a county to address that fact, to make sure that after a death by suicide, we are immediately intervening with a school or business or social network that may have had contact with that adolescent to promote healing and reduce risk. So in terms of our recent events, my program continues to work with schools, particularly with 4J, to bolster their postvention, intervention, and prevention efforts to address the deaths that occurred in their district. I've also consulted with with Bethel and Springfield as well. So back to the findings of this report. So some of the risk factors that are important to take a look at here are in terms of mental illness and substance abuse. Among those people who had a mental health problem or a diagnosis of some kind, 80% suffered from depression. So depression in our community, on average, we have about 7% of the population suffers from major depression. So it's a relatively prevalent, common diagnosis, but it's particularly a strong risk factor for death by suicide. Now, in terms of who seeks treatment among people who are at risk of suicide, around 75% of women in general in Lane County here have sought treatment before their death by suicide. However, we're missing an enormous chunk of men, and that's where, as I shared earlier, the burden and risk of suicide resides. Very few men ever sought mental health treatment before they died by suicide. So meaning that 40% ever sought treatment, but only 30% were currently in treatment at the time of their death. So this really highlights the fact that that mental health interventions are incredibly important, but they're going to require quite a bit of work outside of the medical sector. It's going to require an entire community effort to support folks who may be at risk, particularly, as I shared, men. In terms of other mental health issues or suicidal behavior, women in our community are 2.5 times as likely to have attempted suicide before their eventual death by suicide. This is parallel to state and national findings that women have, despite their the lower likelihood of them dying by suicide, they are much more likely to have attempt suicide. And then also, this is really important because I think that the influence of alcohol sometimes gets overshadowed by other substances. It's still this persistent substance in our community that's causing a lot of harm. That 1 in 4 decedents had suicide decedents had a problem with alcohol, meaning that they were either in recovery, currently addicted, or it was causing some sort of disturbance in their life. So as I was sharing earlier, I think it's really important that when we're thinking about suicide and its prevention, that we are thinking outside of just the medical sector. In Lane County, nearly 1 in 10 people who died by suicide during this study period, this changes a little bit. So between 2003 and 2015, this is just based on the data that we have available to us, is that nearly 1 in 10 people worked in the construction and extraction trades or mining. And here in Lane County, that really means mostly construction. This again is parallel with with national findings. The CDC came out with a report a couple years ago analyzing the same issue and identified forestry, farming, and agriculture and the construction and extraction trades as the highest risk populations, occupational populations for death by suicide. And that holds true here in Lane County. So the other part that's important to acknowledge about risk for suicide in Lane County is some of the regional aspects that our county experiences. So what you're looking at here is a way to identify risk among different regional populations. So in general, our metropolitan area, including Eugene and Springfield, has about the same risk for death by suicide as the county as a whole. Additionally, also the non-metropolitan area, so everything excluding Eugene, Springfield, also has about the same, on the whole, about the same risk for death by suicide compared to the county average. However, when we start digging in a little bit deeper, what we start to notice is that some of our communities in rural areas have extremely elevated risks for death by suicide, particularly on the coast in Florence, where during this period, from 2003 to 2015, 69 residents died by suicide, compared to in Eugene, where roughly 400 did. What this means is that in Florence, there's 3 times the risk for dying by suicide compared to the county, and this is after adjusting for age. I think a lot of folks, Florence is a retirement community. A lot of folks might look at that and say it's well because there's a lot of higher risk populations there, and that is definitely part of the issue, but this exceeds what we would expect, essentially, in terms of suicide mortality. Other communities that have experienced increased suicide mortality are Cottage Grove and Junction City, which both roughly have about 2 times the rate of death by suicide compared to the county as a whole. What this means is that we are going to need to have dedicated community collaboration with these cities to address this issue, because the particular risk factors and opportunities to prevent suicide on such a localized level like that might look quite different from place to place. Okay, and so lastly, it can't go unacknowledged how people die by suicide in our county. So what you're looking at here is some information on the mechanism of death by suicide in the community. So this is for all ages. This changes by age, but I've just shared just kind of the overall picture right now. In the report that's forthcoming, we can see how this does change between age groups due to access to lethal means. So, but on average, in all populations in the county, 57% of people die by the use of a firearm. 19% die by poisoning, and 18% die by hanging or suffocation. Other means are certainly present, although far less frequent. So why this matters? This is obviously a contentious issue when we're thinking about firearms, particularly, and how we would address either lethal means restrictions or even more simply, gun safety. But there are opportunities for intervention, and there's a real great website that brings all this information together through the Harvard's public health school. And what they've identified is a number of studies that show opportunity for intervention. So they base this on a couple of different points. Roughly half of near lethal attempt survivors carried out their attempt within 10 minutes of planning it. So when I talked earlier about suicidal ideation or thoughts of seriously considering suicide, there's kind of a way to think about it is there's like another level, essentially, that of suicidal intent or planning that occurs. And that planning phase can oftentimes be quite brief, and it can actually pass. So what that means is that if we are able to change the physical environment, including the lethal means that are available to a person, then we can actually save a life. This is a real opportunity. The other piece of information that's important to acknowledge in terms of lethal means is that 90% of people who attempt suicide but do not die don't go on to die by suicide in the future. So that one chance may have been an opportunity to prevent and intervene on something that is not inevitable, but is absolutely preventable. So therefore, limiting access to lethal means during any crisis is a critical component of protecting people from death by suicide. Here in Oregon, you may be familiar with Senate Bill 719, what's known as a red flag law. We call it the Extreme Risk Protection Order. It gives an opportunity for family members and law enforcement to collaborate to remove lethal means from a person's environment during a period of crisis in which they may be a harm to themselves or others. It's also important to acknowledge that, like I shared earlier, whereas not just restricting lethal means is important, but that just the promotion of the concept of gun safety is absolutely critical. This work, however, requires the input of gun store owners, hunters, gun clubs, gun safety, gun rights groups. Everyone must be at the table. Formerly, we had a lethal means restriction group in Lane County that addressed this issue, and it would be really important if we were able to restart that work again to bring everyone to the table. So some of the takeaways from this analysis. 1 in 4, just to reiterate them, 1 in 4 deaths by suicide in Lane County occurs among veterans. Like I shared earlier, that's 234 veterans have died in Lane County between 2003 and 2015. Very few, the burden of suicide is among men in our community, 77%, and very few of these men ever sought treatment or were in treatment at the time of their death. Again, highlighting this issue that this is a community. We need to engage men in treatment more, but in the meantime, our community needs to be prepared to assist. 1 in 4 of suicide decedents in Lane County had a problem with alcohol of some kind. Relatively common diagnoses such as depression or dysthymia, which is just a long-term persistent depression, are the most common diagnoses among people who die by suicide. Like I shared, over half of decedents died with the use of a firearm, and nearly 1 in 10 decedents in Lane County worked in the construction and extraction trades. I forgot to mention when I shared that fact earlier, like I shared, this is a known issue among the construction industry, and the Construction Industry Safety Alliance has actually created a number of programs to address the issue. This is an issue that has actually been addressed at construction conferences, industry conferences, in terms of how to implement mental health into occupational safety programs. So some of the recommendations that I'd like to share with you, and there are many, many more in the full report that will be published later in August for the entire community, including the general public, health sector, policymakers, schools, everyone, frankly. But I brought to you just a few that I think are more important for the Board of Health. So the recommendations that I'd like to propose is that we encourage enhanced collaboration between the District Attorney's Office and Public Health to review all deaths by suicide among Lane County youth during child fatality review sessions. I don't know if you're familiar with the fatality review sessions, but it's an opportunity to bring a large group of people to the table who are first responders, medical examiners, people who have information that have worked with the suicide victim, to find out what happened, why it happened, and how maybe future deaths can be prevented as a result of this information on a much more granular level than what I can share with the statistics that I've reviewed already. What I would also recommend is the development of a local suicide fatality review team. What that would mean is this is a little bit different. It would look similar to a child fatality review session. However, it would be focused specifically just on suicide. There's a model actually in Washington County in which they do this, and they have experienced enormous response from it. I can go into details if you would like me to about what this looks like, but just on a brief anecdote, what they found in Washington County were some things that were really important during these fatality review sessions. What they found on this really, like I said, this granular level was that a number of people had been giving away their pets previous to their death by suicide. And that identified a real training target for them. And so when I say giving away pets, the important part about this, we've heard about people who are giving away their possessions before taking their own life. And this is an example of that. And it's an example of a real moment of imminent crisis. So in Washington County, what they found was they got out there and they immediately trained all of their local veterinarians and shelters, animal shelters, things like that, in suicide prevention and identification. And they almost immediately started receiving reports that these folks had been intervening with folks that they had identified at risk for suicide, and after questioning, they said yes, actually. And so there is evidence that these programs like this can identify points of intervention that save lives directly. My final recommendation would be to encourage all residents upon publication to take a look at the report that will be forthcoming. It's a lengthy document. It's a big comprehensive analysis, and it will have something for everyone about how they can be involved in preventing suicide in our community. So I thank you, and like I said, I have my information up here if people would like to contact me or Public Health afterwards with any questions. Thank you.
Mr. Chair, if I could just add as we transition to the board, as the Board of Health, we've talked about a number of health needs and health crises in our community over the years. And this one, I think, is that particular opportunity to look at that intersection between mental health, which we've talked about a lot over the years, and our public health model, because this really is a public health crisis that's related to mental health conditions. And what I appreciate about the public health model is that it really does tell us that if we can identify the risk factors, really point to those causal factors, then that tells us where we can target our interventions for the greatest impact. And I just so appreciate Roger's work on the epidemiological side to help us be able to target what the conditions are in our community, so then we can take those next steps in really designing strategies to address that.
Commissioner Farr.
Thank you, Mr. Chair, and thank you, Mr. Brubaker, for your presentation. Before I say anything else, I'd like to acknowledge Roxanne Wilson in the room this morning. Roxanne is the mother of Chloe Wilson, who took her life in February, and I've spent quite a bit of time listening to Roxanne and the work that she is doing with other parents and other peers of Chloe's age. Thank you for that work, Roxanne. Roger, thank you for your work. I spent, you had a 4-day postvention training in June, middle of June. And I spent a part of the first day and a part of the 4th day there. And a lot of people spent all 4 days going through intensive training on many of the things that you're talking about at this point in time. And I have a quick question. How many people completed that training? Do you have a number off the top of your head?
Yeah, roughly. I can't remember the exact numbers, but in terms of people trained during that training, there were roughly about 40 individuals in the community trained. But we also, it's really important to highlight, we certified 16 trainers during that time as well, so that we can to be able to go out in the community and continue this training. Particularly in postvention in schools, mental health services, social services, and the community at large to address that moment after death in the community.
Thank you. And Mr. Moker, I see Ms. Gaffney. I'd like to comment on that training. I did spend a part of the day, half a day the first day and half a day the 4th day, and I was very impressed with the speakers that you brought in, but also with the interaction in the group. The speakers allowed the group to fully interact among each other and talk about prevention and postvention in ways that it just opened my eyes significantly to hear that many people so deeply involved, and the fact that you certified 16 people through that. I don't know of any other county that has taken that step. In fact, it came out that the Senate Bill 251, the response plan, that Lane County is the first county to complete this Senate Bill 251 response plan. I don't know all the details of that, but I write down quotes, and that's one that I wrote down. it seemed, the response plan, Senate Bill 251, can you talk about that a little bit?
Yep.
The response plan?
Yeah, sorry to correct, 561. Yeah, just
561,
for your notes, I
excuse me.
know it'll be important. Yeah, so Senate Bill 561, I'm forgetting exactly when, but about, I'm going to say roughly 2 years ago, was passed into law, requiring that every county identify an individual or a group that responds on an organizational level to coordinate the postvention response after a death by suicide. So in our county here, that's me, with a number of backups in both behavioral health and in public health. And so what that means is, because this is addressed primarily towards adolescents, is collaboration with our local tragedy response network, which you may be familiar with, which is a group of individuals who are identified at every school district in our county that are prepared to respond in a crisis and also collaborate with one another. So after a death by suicide, I contact that particular member if it's in a school, if it's school-based, or try to find any other organization that person may be attached to, because like I shared earlier, that's where we're talking about the risk of contagion. So we're trying to think about how to work with that real local community to promote healing and reduce risk. And that can look a lot of different ways depending on the setting.
Well, thanks, Roger. And you know, this brief report, and it really is a brief report that you're presenting today, is just scratching the surface of the work that is underway and the vast amount of work that's ahead of us to step in, you know, as you said, 10, 15, 20 years prior to the event. However, in the case of Chloe Wilson, there wasn't a 10, 15, 20 years prior to the event. So being alert and aware of the signs and the possibilities of postvention. You know, I additionally attended a training session one evening, and Ms. Wilson was at that one also, as was Commissioner Lycan, which was Dr. Bradshaw. Pilar Bradshaw had a large group of people, including people from Lane County Behavioral Health and school districts, talking about particularly the adolescent suicide issue and how to post-vent, but more importantly, step in ahead of the curve. And some interesting ideas came out of that, and I'm kind of keeping an ear to the ground to see what develops from that particular, what I thought was very thoughtful and eventful evening. And Carla Ayers was there, among others, and so that I received a great deal of information from that. And one thing that stood out in particular that evening is that a young lady stood up and she said, "I'm looking around the table and I see a lot of mature people." She said old people. And she said, "I don't see any kids here talking about this." And this was specifically regarding adolescent suicide that evening. So I think one thing that has come from that, I believe, is that we're looking at how do we involve kids in it? How do we get a network of kids who potentially are the first observers of the possibilities, you know, the signs of suicide? You know, you mentioned giving away pets. Well, a list of things that may happen prior to an unexpected, you know, unforeseen suicide. One thing that came out of it is that suicide is let's see, it's a violence prevention, and we're talking about the elements that go into prevention of suicide. Many of the elements are the same as the elements of preventing violence of any kind. But it really is it particularly hits home when you see it occur in your life, or simply it's very, very close to your life, and all of a sudden your attention span is broadened as far as the possibilities and the capabilities of people doing this. So I thank you for your work. Once again, barely scratching the surface of the work you've done, and barely scratching the surface, Mr. Mokrajewski, of the work ahead of us as we move forward in this very important field of area of, you know, prevention and postvention. Postvention being also a part of prevention as a cycle. So thank you very much. I have a lot to say, but I know others have things to say too. Roger, thank you very much.
Commissioner Lycan.
Thank you, Mr. Chair. And I also want to say, Roger, thank you very much for the presentation. If we could go back on the slide, especially to the Harvard piece that you showed. So the first sentence up there, so roughly half of near lethal attempt survivors carried out their attempt within 10 minutes of planning it. 10 minutes isn't really planning it, is it? I mean, basically what that is is it based on something happened, therefore, that's it, I'm out of here. Yeah, and so that's half. But the other half, now, are you telling us the other half is basically suggesting that maybe this has been a 2 or 3 day or 5 day planning event, or how is that? And maybe if you could kind of explain that. And I mean, I could obviously, I'll probably click on that and kind of get, but to hear for the Board of Health, if you could just maybe give a snapshot explanation on that piece, because half, maybe on an emotional outburst, something happened, and whatever reason, someone decided, I'm out of here, I'm giving up. But there's obviously another story there that another half says, I'm giving up, but I'm going to plan this out. So maybe if you could maybe comment on that.
Yeah, absolutely. So when I say planning, it's actually, it sounds like a simple term, but it's really important to identify what that means. So when you were saying that something may have spurred someone on to feel that they're going to take their own life, that's actually not what I'm talking about.
Okay.
Yeah. So the planning is actually how they are going to do it. So there's that's what I meant about this kind of next level.
Very
so
good.
they may have been considering taking their own life for quite some time, but that moment in which they said, actually, this is how I'm going to do it, when I'm going to do it, occurs oftentimes quite briefly. That's why there might be limited time for intervention because that person simply might be alone. And so the environmental factors in terms of access to lethal means are so critical.
Okay, that helps. So I
Okay,
appreciate
good.
that very
Yeah.
much. Thank you. And the other comment, so I mean, it's that graph, especially with men. And I wish I had an answer for that, but I don't. And I don't know what it is about us men. But, our most common phrase is, I'm okay. I'm all right, honey. I may get hurt and my finger's sideways and I'm saying, no, I'm okay. Or I'm going to go show it to my buddies. Hey, look at this. Man, look at that finger. Doesn't that look awesome? I mean, I don't mean to make light of this at all, but that's the reality. I don't have a very good, and I'm going to suggest that that's probably one of the most difficult areas of research that you're going to find is men inherently, I'm okay. I mean, that is such a common phrase, and I will tell you, it took me a long time to figure out, I got to watch my health here. And the final straw for me is I had an anaphylactic shock issue that came up over a year ago, and I thought I was checking out. And all of a sudden now it's about, okay, I better pay much closer attention to this. But if men are thinking of this suicide, the challenge, I think, is their loved ones don't really realize it because the common phrase is, I'm okay. And I don't know if that's maybe what you're finding out in your research, but that graph is stunning, especially on, what I found interesting is the age. It gets worse for men, but women go down.
Yep.
And which, again, I'm not that surprised because of the communication that's going to occur, and women having it, and I can only speak for, just the women in my life, but if there's issues going on, they seem to be able to gravitate toward each other or get support or reach out to those supporting, where men, on the other hand, I don't know. I don't have an answer for that. And maybe if you could just comment briefly on that and what your research is showing, and then if that is truly the case, because that is really going to be difficult to identify in the future, especially as men age. How do you get men to say it's okay to say I'm in trouble?
Yeah. So when I look at the suicide trends among by sex, among men and women, I don't just think of it as a question about what men are doing, but it is absolutely about masculinity. I think one of the most dangerous things we can say to a man or a boy when he's growing up or as he ages is, be a man, tough it out. This is the message that people receive that makes them much less likely to reach out for help, to think that help is available and that it's okay to reach out. Specifically in terms of suicide, one of the most alarming studies, when you read about suicide all day, your threshold gets a little low for alarming studies. One of the most alarming studies, though, that I ever came across was a study done back in the 90s that demonstrated it was a number of interviews with, again, very near lethal suicide attempt survivors. Okay, so people that really were quite close to dying by suicide and demonstrated full intention of doing so. And after interviews with them, it came out that they actually looked at men who attempted but didn't die as suicide as cowards in some way, meaning that there was this stigma attached to surviving suicide by not just doing it. So there's a big general mental health issue going on among men in terms of reaching out for help, thinking that help is available, and not feeling stigmatized, but also in relationship to suicide, that there's an enormous stigma issue for men. So this is where I always talk about how important it is to address this as a public health issue. This is really a cultural shift that's required in which we would look at masculinity quite different and how men behave as men and identify as men, and in their help-seeking behavior and in their care for their own health. So absolutely, I agree with you, but I think that cultural shift, that's a tough needle to move, but I think that we can do it.
And finally, I'll just mention this, that the church I attend, probably one of the most incredible groups is a men's group. And part of that is because there are no women there. You can let your hair out and really share your feelings. And to me, I find it amazing. I mean, I'm 56, but I find it truly amazing when you get men that are in their 60s and older beginning to really share, here's my disappointment and, and stuff like that. But yet they can lean on and gather that support just from a friendly face. And not only that, but then you keep that communication open at all times. And so it becomes more than just, hey, let's go out for, I know it's church, but let's go out for a beer or Coke anyway, or whatever the case may be. It becomes more deeper than that. And so I have found that to be, like, for instance, that's an example. But I think anytime you can get men in some of these groups where they're able to just share their feelings, share their, they may think they're a complete disappointment, and the rest of us are looking at them going, what are you talking about? Disappointment? Are you kidding me? You think you're and so it's kind of amazing. But I just wanted to bring that up. And finally, Commissioner Farr had mentioned about the Teen Suicide Summit that we attended, which was pretty significant. I'm going to send you both an email. I had a recent follow-up from Dr. Bradshaw, and I'd like to send you both an email just to, and I'll include Commissioner Farr on that as well because he's been very active in that. But I don't want to announce it here, but so I'd like to send it to the both of you so you can kind of idea where she is on this as well. Thank you very much. I appreciate this. I think this is something that I'm hopeful that will be, I think, Karen, you may have mentioned this is the first time we've had like a report on this from Suicide Lane County. Yes. So I'm hoping this is going to be like not I don't want to sound morbid by any stretch of the imagination, but instead of a support opportunity, that this is something that can be reported back to the Board of Health on an annual basis, because I think it's very critical. Thanks for the great work, and thanks for the information. I appreciate it. I'm going to hit that link and kind of go through that a little bit more, but thank you.
Commissioner Sorens.
Just quickly respond, Commissioner Lycan, absolutely. The purpose today is to really set that groundwork and share the data with you with the intention of continuing the conversation. I think there are opportunities in the upcoming legislative session. There's discussion from the Oregon Health Authority about POPs that would look at adult suicide. I think there are opportunities when you sit as the mental health authority to think about this issue. So I absolutely would anticipate ongoing conversation.
Commissioner Sorensen.
Not all problems can be solved with money, but sometimes money is helpful in solving problems. I'm curious about some of the things along the lines of the recognition that people that are contemplating suicide will give away their possessions or their animals or other things that are important to them. What are other communities doing, which unfortunately involves money, to track this process? In other words, I'm thinking about the interaction between the people at Green Hill Humane Society or the Lane County Animal Services function, where people bring their dogs in or their parrot in and say goodbye, and the worker, volunteer, person accepting this animal realizes or may realize, having done it before, that that's saying goodbye. And it's not goodbye like I'm moving to New York City to become a public relations official with the Trump organization. It's not like that goodbye. It's more like the goodbye of I'm going to commit suicide. So what programs or any innovative programs where these folks are trained? Of course, it takes money to train them, it takes somebody to go out there and organize it. And what are other communities doing? And not just animals, but any other thing that people are giving away that shows that they're kind of moving on to this idea that the way out of this problem is, and I'm thinking maybe in agriculture, I read where a very high percentage of South Dakota farmers are committing suicide. It's alarming. And you kind of wonder, well, you know, do they stop making payments on their farm equipment? Maybe that would be an obvious thing that would get somebody depressed. What are other ways of monitoring this so that we can identify these people earlier and give them some help?
Yeah, so in terms of our, there's a couple of different ways to address this. Training is a huge issue, as I've addressed earlier and people have kind of mentioned. Talking about this subject at all, about suicide at all, and any of the risk factors that lead to it is so highly stigmatized that it really creates a barrier to people, again, seeking help or being able to reach out to others to assist them. So in terms of training right now, I would say that we have relatively limited training capacity in terms of suicide prevention, let alone being able to identify particular populations. It's why I shared that I think that a suicide fatality review team would be able to really help identify and target those populations more effectively. Other communities are also implementing a program called Zero Suicide, at least, and this is a program that more affects the medical sector. It's a comprehensive way to train an organization kind of in a tiered manner for everyone from frontline staff all the way up to medical staff particularly, and then also change a number of policies and data tracking, the medical records, everything in an organization to really specifically target and support those people at risk for suicide. I think am I addressing your question in terms of what other communities are doing?
I'm always curious when we talk about a very difficult problem, and then we realize, well, there's something we could do, we up here, the Board of Commissioners could do. And one of those things is the recommendation you're making, right? There's a tangible recommendation at the beginning of your program, right? And do you have a board order that says, okay, the Board of Commissioners does approve this, we're going to do this?
Can I start with that, and then Roger can fill in? I appreciate Commissioner Sorensen this question about where do we go from here. And I want to preface my specific answer to saying Roger is our suicide prevention program right now.
Yeah. Is that because we only have one person?
Yes.
So we don't have enough money to have two people?
So I would say that as we look forward about how to really gear up to address this serious concern in our community, Roger's position is it's completely funded by state funds from a couple different sources. But we absolutely, if we're going to have a larger impact in the community, we have to have more than just Roger who's able to focus on this.
My concern is this. If there are some things that are tangible that have worked elsewhere and they cost money, I would like to go beyond the generalities of, gee, there's a lot of people committing suicide. We sort of know why they're doing it. We sort of know who they are, to doing more than what we're doing. And, I'm the new guy up here. I'm the new ideas guy up here, see? So I think we should go beyond that bit of generality, which I think is great. It's very educational. The public learns a lot from this. We learn a lot from it. But what can we actually do? And I think if that's something like a pilot project to go around to all of the people that deal with animals in Lane County, all the veterinarians, all the veterinary assistants, all the nonprofit groups that help animals, our own agency that deals with animals, Green Hill and other major animal helping organizations, if that's a big, component, let's do something about it. Let's propose a program. Let's see if we can get the money to do it, rather than have, and I hope we do have, another good report from you in a while on how we've done something that will address this problem. I think probably one thing that Americans are tired of hearing is, my thoughts and prayers are with you. I mean, I don't know how many times I have to hear that. And at some point, it's meaningful on an individual level when someone says that to you. But as an excuse for government officials, it's like kind of minimal. And I just want to make sure that we are getting the most advocacy out of you guys. If we can't do it, right, we don't have the money, well, that's another answer. We should take the hit for that, because maybe we can't give you the money. I'm certainly a pragmatist. Like, just because you ask for the money doesn't mean I can give it to you. But I got to have some guidance. I got to have some staff. I got to have some people with the kind of drive and intelligence that you have, and caring, because it's not just statistics. We're talking about real people. So anyway, I just want to thank you for it and encourage you in making these recommendations.
Commissioner Sorensen, I do want to let you know that I spoke with the district attorney on Friday, and she's very interested in pursuing this idea of a fatality review. So those pieces are moving forward, and they don't require an order from you to make that happen. And I promise you, we will continue to bring back both policy and programmatic options for you to consider.
And if I can interject quickly, I would invite all of the commissioners, and Commissioner Farr had a brief opportunity to attend one of my suicide prevention trainings. So in addition to writing reports such as these and doing analyses such as these, I also do a number of community trainings around suicide prevention for lay people. And so I would invite all the commissioners, of course, to please attend one of those trainings so that they are able to identify and intervene with people at risk.
Yeah, and Commissioner Williams and I are particularly at risk, according to those statistics, so thanks.
Commissioner Williams?
Thank you, Mr. Chair. And thank you for your presentation. You prefaced your presentation with a reference to first responders. We all have suffered the impact of somebody taking their life, friend, family, mom, dad, child. Very, very difficult. One of the things that I understand people go through is the trauma of it, the sadness, the questions, and in some cases anger about how did this happen, why did this happen, how could we have stopped that? But I'm reminded back to the other folks that are involved in a tragedy such as this, and that is the first responders. When you live in a small community, obviously Cottage Grove, and we saw Florence referenced, and other small communities, it's not unusual. In fact, it would be unusual if in a small community you did not know the victim, you did not know the family, but you also know the first responders and the difficulty that they face in those situations. So I just appreciate the fact that you mentioned those people that respond to lots of degrees of unpleasantness and heartbreak and sadness. And so thank you for that. I appreciate the incredibly sobering presentation that you have and the possibilities that we have that we can have a positive impact on this and helping people who are struggling to cope and deal with those issues and that hurt in their lives. And I do pray for those families that are going through a lot of difficulty at that time and continuing. So thank you.
So, Roger, I just want to thank you for the work you do. It always amazes me when people can make a career out of something that is so difficult to deal with and do it daily. It's difficult for me just having this come up for an hour at a board meeting. I've had suicide touch my life a couple times, and in both cases were well planned, much longer than 10 minutes. Both cases were chronic pain issues with the people and in one case the person laid it out, so I would be the one that actually called the police and took care of his dog and all that. So the pet issue, I understand. He didn't actually give away his pet, but he made sure I was the one that discovered the pet home alone and that he wasn't there. So knowing that, the way I am with pets, I would make sure that the animal is taken care of. So it is a very difficult topic. And I was, surprised to learn about Florence and Junction City and Cottage Grove and those statistics. And I'd be interested to explore that further because I don't see, even with the age adjustment and all that, why exactly. And it'd be interesting to try and figure out some of the whys there so we can work on prevention. Particularly interested in the training of the veterinarians and the shelter people. That seems to be a real heavy tip-off that would help. Kind of interested in the issue with the construction industry and all that, knowing that it's a male-dominated industry. And what's interesting is I've seen the statistics also for professional occupations, and engineers and architects, surprise, are one of the leading professional industries that has a high rate of death by suicide, which, another male-dominated. So the issue of men, coming up again and again, and how can we resolve this issue in American culture, at least, of men not asking for help and that not showing weakness. And I'm kind of curious, and you don't have to answer this today, but finding out about, are there other cultures or other countries where there isn't this significant divide between genders in suicide rate? And then, what is it about those cultures that makes that not there? And that's maybe an indicator of maybe where we might look for some help in trying to resolve this issue about the gender rate with suicide. So I really appreciate that, and I don't need you to try and give me a dissertation on cultural differences in suicide rates today, but I'd be curious to kind of understand that maybe in the future as a direction we can go. But I really appreciate the recommendations, and it's a really enlightening report, and I'm going to have to go back and put my, think about Florence and Junction City and Cottage Grove a little bit more, and understanding those hot spots and why we have them in our community. So I just can't say enough about appreciating the work that you do in a very tough field.
Thank you very much.
Commissioner Farr.
Just two very brief things. One thing I'd like to point out, and I guess I didn't stress it enough, Commissioner Sorensen was talking about you being the only person. In fact, you stated you certificated 16 trainers during that 4-day session. So really what we're doing at Lane County is we're trying to leverage work beyond just Lane County and deep into the community. And really that is the greatest way, I believe, to address any serious issues such as this, is to make certain that we have a broad approach rather than a focused approach by just one government agency. Because we are just one government agency, that's all we're ever going to be. And we can, though we do have a great health department, both public and mental health departments, behavioral health, we really need the help of the entire community. And I see people sitting in the audience today. I see Hayden Spence, for instance, sitting in the back of the room, who is a recent graduate of the University of Oregon and is dedicating much of his thought and much of his time to this very issue. That's why he's here today. So, you know, we're digging deep into the community, enlisting more help that doesn't require more money from Lane County, though more money is going to be advantageous down the road. We are leveraging the resources that we have right now and making certain that it's not just you, Roger. I'm not sitting here thinking, boy, Karen, all we have is Roger. Oh, wish we had two. Well, we don't have two. We have all of the work that Roger does that spreads out deep into the community. So thank you for that. And the last thing I'll mention is that the Family Education Privacy Act. We talk about finding ways to maintain people's privacy while at the same time allowing access to critical information that potentially can avert disaster, tragedy in the future. We recently worked on CFR 42, for instance, which is an old federal regulation regarding disclosure of mental health treatment records. And while we're not interested in invading people's privacy, the FERPA Education Privacy Act, our mission is to prevent student achievement and preparation for global competitiveness by fostering educational excellence. Well, it came out that one of the main, a quote I wrote down is, FERPA is such a huge barrier to involving the family. When information comes out in schools, making certain that we're able to involve the family in critical information that potentially can prevent a tragedy without breaking what are the laws of the land regarding privacy and making certain that that students' rights of privacy are upheld, but at the same time, our ability to respond to potential tragedy is not diminished or is not evaporated completely by a privacy that really is intended to do something very different. Privacy that's intended to allow students the fostering of global competitiveness, which is what FERPA is all about. Well, not telling parents that their kids are contemplating suicide, I don't know if that's what FERPA meant. I don't know that that's what FERPA had in mind when the act was passed. So we have work to do, both locally, throughout the community. We also have potentially some federal work to do to make certain that we are able to use all of the tools that potentially we can, all of the arrows, so to speak, that we can put in our quiver to make certain that we are dotting every I, crossing every T, and addressing every possibility. Roger, you're doing it, man. I tell you, I've sat in rooms with you now at least 6 times and seen you engage people and fire people up, and I've seen light bulbs go on as you talk, Roger. That's what it's all about, and congratulations and bravo for the work that you're doing.
Thank you very much.
Any further comments from the board or questions? Well, thank you, Karen, for a great presentation, and I look forward to future work.
Absolutely. Thank you.
So with that, that's all we have for the joint Board of Health, Board of Commissioners meeting. I'm going to adjourn that meeting, and now we'll convene our regular meeting of the Board of Commissioners for Tuesday, July 31st, 2018. And the first item is adjustments to the agenda. Any adjustments to the agenda for the Board of Commissioners today? Seeing none, then we'll move on to public comment for the Board of Commissioners. And we have 4 people signed up for public comment, and hopefully they all stayed, not quite. No, I'm already, unfortunately, at a rather lengthy Board of Health, it was not planned to be quite so long. The first person signed up to speak is Wayne Martin.
Good morning. It's good to be here in front of you again. It's been a while. Appreciate your work. I'm Wayne Martin. I live at 931 Taylor Street in the Jefferson West Side neighborhood. I retired here to Eugene from a career in pastoral and hospice care in 2012. It's a good choice. I've got family all over me, and it's fun, and I've got grandchildren, and I'm engaged, and in my first year, in 2012, by the end of the year, I was asked to be on the steering committee for the Opportunity Village and served on their very first vetting committee before we opened our gates in 2013. At that same time, I volunteered time and energy trying to assist, and you'll remember this, some of the 150 homeless that were being evacuated from the BLM properties in West Eugene. Where did I and my Subaru try to relocate them to? Wherever they told me to take them, whether it was prudent or not. Out of that grew up an area at Broadway and Hilliard, as you well remember, and that lasted for 8 months. During that time, I tried to rally as many volunteer efforts from church folk as possible to help with meals and drinking water and health care, wound care issues, detox support, anger management stuff. When that was disbanded in April of 2014, 6 of us began discussions of trying to form a rest stop similar to the one that had just taken effect at Roosevelt and Garfield. Thanks to efforts by Commissioner Farr back in November of that year, and subsequently the rest of you, thank you. And the initiatives of Steve Mokraheisky and Michael Kinnison of the city, Nightingale Health Sanctuary was launched next to the county health site on Martin Luther King. Today, Nightingale is in the middle of its 4th full year of continuous operation. Thanks again. In April of 2017, I helped initiate Ward 9, which is an advocacy group for the needs of unhoused folk made up of unhoused folk. They meet once a week. 4 months ago, a group of my neighbors began meeting in my living room to explore seeing if we could get a Conestoga, 3 Conestoga huts located on the county property. You've probably heard conversations of this in the past. Near the fairgrounds, the Lane Events Center. We've been doing a lot of legwork. This morning, I'm simply here to offer you that this is the latest of my interests, and we have prepared a proposal, and we're working on that, and we want to present that when you reconvene in September. I've got a meeting that is in the process of being set up with Corey Buller of Lane Events so that he can be involved in the discussion of the proposal and maybe help us make some changes as needed to that proposal. In effect then, thanks for letting me have this time, I just want to let you know that we will be asking you to work with us in this project. On my way in this morning, I met and chatted with John Reese, and I said, we have an interest in putting 3 Conestogas on county property, and he said, great, great, because they're now looking more diligently for small gatherings that can lead to larger gatherings. Thanks for your time. Thanks for your efforts. Thank you, Steve.
Thank you, Wayne, and I'll just remind you, we actually do have 2 meetings in August, the 21st and the 28th.
Long month.
Yeah. Next on the list is Jerry Ross.
Good morning. Thanks for allowing me to make a comment. My name is Jerry Ross. I'm a local artist. I live at 203 West 52nd Avenue in the Solar Heights development. For 7 years, I've been working in a group I founded called POEM, Post Office to Eugene Museum, with the aim of transforming our historic Art Deco post office into a municipal art museum and art center. You may remember that in 2011, the post office was for sale. It could have been sold to McMenamins or any local business seeking to turn that into a restaurant or something like that. However, I was able in 2011 to get the historic preservationist of the state of Oregon, the city of Eugene, and the Postal Service to declare that the lobby area of the post office will remain federal property in perpetuity, which effectively protected the Carl Morris heroic timber and agriculture murals. And immediately after that, the for sale sign was taken down. And because the commercial value of that property went to zero once the lobby area could not be touched. What you have before you, you'll have a handout of a decision by the Central Committee of the Democratic Party. It's a platform resolution. I'll just comment on some of the points. It says, whereas the Eugene community lacks a permanent collection of local artwork. This is the issue of legacy. We have many, many very talented artists here in Lane County, but when they age or pass on, there's no place for their artwork to be housed or shown to the public. So the artist effectively has zero legacy because of this situation. Whereas the Jordan Schnitzer Museum on campus is a state museum and its mission is not focused on regional artwork. Whereas the Jacobs Gallery recently closed, and by the way, although they are hosting the Mayor's Art Show this week and this month, my understanding is that it's only a fraction of the size of its original scope and that it's being used for city offices, and that will not return as a public venue for visual art. Whereas the local artist community has been advocating for a downtown art museum center for many years, and whereas the local art museum center would uplift our community members and our community as a whole, both culturally and financially, whereas congressional leaders, I've visited the offices of Senator Merkley and Congressman DeFazio and met with their people, and they're in support of the idea. However, because of money issues, they are waiting for a sign of public support here locally for the project. Whereas the Coos Art Museum provides a working model of a community-sponsored art facility at a repurposed post office. They down there have a sister building. Ours was 1936, I believe, and theirs is 1938. But the buildings are identical architecturally. And in 1966, they repurposed theirs with the help of Senator Mark Hatfield. While the Postal Service was still in the building, they, with the help of Senator Hatfield, were able to transition the post office to a more modern facility and transform that building into an art museum in 1966. Whereas the downtown Eugene Post Office is a historic preservation site with a memorandum of agreement that effectively makes its sale to a commercial entity non-viable, and whereas the post office has plans to move to a more modern facility, therefore, the resolution states that the Democratic Party of Lane County empowers a subcommittee, which I head, by the way, to advance the transformation of the historic downtown Eugene Post Office into an art museum or center, and we'll send a copy of this resolution to various political entities like the city council and so forth. We have the support of Mayor Lucy Vinnis and also of the Lane Arts Council in this effort. I realize it'll take a civic stadium door-to-door campaign to raise the funds to secure the post office once the political leaders enter the effort and help us transition on a federal level that building to a municipal arts center. So my purpose of coming here today is just to let you know this project is underway and hopefully gain the support of the Board of Commissioners. Thank you very much.
Thank you. So Roxanne Wilson.
Good morning. I wanted to thank you for your attention to the issues of suicide prevention and your commitment to make a difference in the county. I really appreciate it. At some point, I would like to request a private, longer audience so that I can talk more about some prevalent issues concerning the county. And I would appreciate it if you guys could let me know when that would be most appropriate. I'm going to read this really quick. First, I wanted to ask a couple of questions to think about concerning that report. The first one is, have they included the expressed needs of our community members about what they're actually experiencing in this county that makes so many feel so powerless, hopeless, attacked, and alone, that Lane County's suicide rates are 4 times as higher as 85% of the counties in the U.S.? I have tried to urge them to include that, and at this point, I don't think that has happened. But also, another question is, how many middle-aged or older adults have lost an adolescent child or sibling by suicide at some point in their lives? And does that affect the suicide rate in older people? I wanted to read something that I wrote in my undergraduate education. It's called Removing the Blinders, Power versus Empowerment. I revised it recently after Chloe passed, and added this first part. Anyways, my husband and I have recently been challenging the current idea shared by many health and human services professionals that only adults are equipped to provide the supports necessary to decrease mental illness and suicide in our youth. What most adults don't seem to want to face is, 1, the current system of talking to a therapist for an hour a week or 2, and or taking a few pills that increase suicidal ideation sometimes is not working. And 2, these young adults are far more intelligent and far more capable of making real and lasting change in their world than the adults in their world who hold tight to the power give them credit for. And this is not directed toward anybody here, just saying. Yet as a collective society, we wonder why they feel powerless. These young adults have been bombarded with information since birth. They are not sad because they don't understand. They are sad because they do. Sorry, just a second. When they begin to realize they are powerless to change the things in their youth culture that make them sad, such as bullying behaviors, and the overall environment full of constant negative, well, actually they call it constant negative vibe. I say energy, but their word is vibe. That sadness turns into hopelessness, and that can all too often be very deadly, a very deadly transition. The removal of the blinders to the very real horrors of our youth today is what prompted my husband and I to found the Youth Supporting Youth program with our nonprofit. The only way we will have any real hope of improving the quality of life and decreasing youth suicide rates is by empowering and supporting our youth to learn and practice using the tools that will protect them from the dangers of the very adult world they must now survive in, like a chrysalis that will help them, that will keep them safe as they transform themselves and their very culture from one of desensitization and sensationalism to one of unconditional love and support, like the formation of the wings of the butterfly. This is not a fantasy, it is survival. We, our community's parents, teachers, administrators, mental health, and other professionals, agencies, and governments have the power to make the changes we are all trying so hard separately to make, but not the way we think, and certainly not the way we have been going about it thus far. It is not us who have the potential to create change in our youth's world. It is our youth themselves. The only way we can help them make real and lasting change happen for themselves is by uniting as their village, backing them and empowering them through training, knowledge, and support, and be the change they need for their own survival. They have the basic human right to their own survival. Our youth today are not just kids anymore. It's time we stop wishing that isn't true and start accepting it. Until we can all come together with one united focus to reduce mental illness and suicide in our youth by empowering them to be the change they want to live for, we will continue to be as ineffective and inefficient in this endeavor as we have up to this point. Behavioral health begins with us. We are our children's village. Let us start behaving like one. Thank you.
Thank you, Roxanne. So I believe Betty Grant left. So I think that's everyone I have signed up for public comment today. I don't see anyone else that looks like they need to address the board this morning, so we'll move on to commissioners' response to public comment and/or other issues and remonstrance. Commissioner Sorensen.
Thank you very much. I just wanted to mention something a bit outside of all the public comment. Before I do, I just want to thank everybody that's here who did give public comment, and I appreciate hearing from you. Today is International Ranger Day. Did you know that, Mr. Hurley? I did not know that myself until I learned that earlier this morning. International Ranger Day honors park rangers throughout the world for their service to public parks, whether that be national parks or state parks, county parks, city parks, and any park ranger that helps maintain parks and keep the public safe. And so I just thought I'd mention that. I just learned that courtesy of Bing.com, so it's not like I did a lot of research on it, but I know we have some park rangers here in Lane County, and they don't always get the recognition for the work they do, and sometimes it can be pretty difficult out there with people who aren't always cooperative and don't always observe our no littering rules and don't always observe our no smoking rules and don't always conduct themselves perfectly. But the rangers are out there and they do a good job, and I just wanted to compliment them.
Commissioner Williams.
Thank you, Mr. Chair. The gentleman that spoke about the post office and the art museum component to that, was he looking for something from us as far as a letter of support or anything along that line?
Yeah, he put together that resolution, and I think he wants the city and county to approve it.
Like, kind of assumed that, but I didn't actually, you know, I must have missed his direct request for that. So I just wanted to get some clarity on that. Thank you.
Commissioner Farr.
Thank you. Mr. Hurley, when Commissioner Sorensen started talking about Rangers and mentioned your name, you as a West Point graduate, I thought, of course, he was talking about Special Forces, but he wasn't. You know, just very quickly, I had a chance, I mentioned last week, to sit on a panel at the National Association of Counties talking about our Frequent Users System Engagement Project. And Mr. Mokrahajski, I wanted to mention, I sat next to Dr. Jenny Simpson, who is the public health innovator, the Office of Policy Planning and Innovation. She's the public health innovator for SAMHSA. And she was really very curious about our FUSE program and mentioned that there may be some funding available that hasn't really been publicly on the out in the airwaves. So I'm going to pass that information along to you and Ms. Gaffney and to Steve Manella to let you know that this lady is very interested in what we are doing in Lane County regarding jail diversion and addressing behavioral health issues. So that was a very enlightening moment when she was taking lots of notes and asked lots of questions afterwards. So the other thing that I want to mention is that I did have a chance after our mental health summit. We have a mental health summit once a month. Ms. Gaffney is always at those. And it's a pretty interesting group. It's an amazing group of people that sit around the table talking about ways to leverage the resources we have to address behavioral health issues and to make certain that services are focused in the right area and that we're all pulling in the same direction. But after that, I spoke to a kind of an independent mental health therapist who talked about forensic work in most behavioral health programs and how the forensic work, if it doesn't include residential, then it really is kind of losing the opportunity to leverage all of the work that we do with people who are suffering from and addressing behavioral health issues. So it underlined the importance that I often have an opportunity to state of how important it is to have beds, safe places for people to sleep. Reverend Martin talked about safe places for people to sleep, and we often talk about the continuum, the housing continuum of safe places for people to sleep that begins with shelter. It begins with getting people out from under bushes, continues ultimately potentially to home ownership. There are many steps along the way. And one thing, Ms. Gaffney, you're still here, that we're doing here in Lane County is we're making those steps shorter and shorter. So if to get from one level of housing for people who have historically been homeless or had housing instability, to the next step, which is more stable, if the step is so great, very few people are able to take that step. And as we add innovative new ways to address housing needs and front doors and safe places to sleep, then we're making those steps smaller and thereby allowing people to move through the continuum of stable housing and really get to a position where our frequent user system engagement program is most effective. If we are able to put people who have either chronic or situational behavioral health issues or substance issues, then if we have more places for them to sleep safely at night, then we have more ways to ensure that their treatment and their medication regimen is upheld and maintained. So it's a great effort that's going. Really, it's going beyond our county lines, and the work that we're doing here in Lane County really is significant in terms of innovation, breaking through, and in fact, raising the eyebrows of SAMHSA. Ooh, that's not a bad thing, I don't think. So thank you very much.
Any other monstrance? Commissioner Williams?
Thank you for the second opportunity here. I just want to take advantage of this. I could have done this at the end of the meeting, but I'm not sure if Mr. Hurley would be here. So I would just like to acknowledge the fact that we're doing a lot of work out in the roadways and the highways and byways. Some of us are getting some calls about that, questions, but it's very exciting to be able to tell folks that there are safety improvements being made on the roadways, and very, very exciting. I was in Lowell over the weekend, Blackberry Jam. One of the things that I noticed on the way up on Cloverdale Road, just before 58, there's one of the little reader signs that tells you how fast you're going. Awesome. That's the best highway safety technology I've seen in a long, long time. They're very effective. I also noticed another one, I believe, on Dexter Road, which, again, those are, Dexter's kind of an interesting little lane that goes through the backwoods with some curves and some of that, but it's a very nice drive. But having that speed indicator sign, absolutely of value. I actually pulled over and observed as people would come, and they were approaching that at a fairly good clip. But when they see that, they slow down, and they make a difference. So I would encourage that where we can, we place those, rotate them, get more of them, because they're extremely effective. So I just did not want the opportunity to give a shout out to the great work that your folks are doing out on the highways. We're fortunate to have that influx of dollars to make those improvements. But in closing, I would ask the citizens of Lane County and visitors to be especially mindful in those construction zones of the people that are working to slow down. Be aware, but in short, thank you. And if you'd pass on the kudos to the road crews and those others involved, absolutely fantastic work they're doing. And I, for one, am grateful.
Thank you. And I just, while we're talking about roads a little bit, as a cyclist, I just want to really appreciate the great paving job you guys did on Crow Road. I mean, that is just smoother than the proverbial baby's bottom. It's a great road to ride on now, and it wasn't before then. And I really,
Other than the actual one, too.
yeah, it is really the crew, the public works crews just and do a great job out there maintaining our roads. I can't say enough. And while I'm at it, I'll mention something that's on the consent calendar just to call it to folks' attention, because we usually don't separately acknowledge items that are on there. But we are doing some street dust mitigation for the first time in a while, which I think is really important, but is a sign of the additional funding we've gotten out of House Bill 2017 that Commissioner Lycan helped get through the legislature, and that additional transportation dollars are helping with these projects like Crow Road and the various roads getting repaved with the feedback signs. Without that additional funding, those things wouldn't be happening with the dust control and the dust mitigation. I've already heard from the folks on Hall Road. They're really happy. So just take a minute for that. I do want to also mention I got a chance to meet with Brian Steffen, who is the new executive director of the YMCA here in town. And I was interested to learn of his experiences in Montana, and that they've become one of the largest child care providers in the state, and his desire to expand their child care programs there at the Y. It also, we had a long discussion about adverse childhood experiences and parenting education, and being able to maybe wrap some of that into their programs because of what that does for the future of those folks, whether it's, homelessness prevention, criminal behavior prevention. Everything comes back to some of that early childhood experience, which ties into Ms. Wilson's discussion here. So it might be an opportunity for Ms. Wilson maybe to meet with Mr. Steffen and maybe talk about some of his programs, because there may be some crossover there. I will note that the Board of Commissioners know without some of the provisions for executive sessions and other exceptions to public meetings laws, we can't as a board meet privately. So if you wish to meet with us and have long conversations, it's going to have to be individually. So please feel free to drop any of us an email and try and set up a meeting. If you just go to our website under Board of Commissioners, all our emails are right there. There's also a generalized one that gets to all of us that we can respond individually back and help set up meetings. But we can't, state law prevents us from doing anything outside the public eye, with very few exceptions, which, things like dealing with a real estate deal, or, negotiating with our bargaining units, doing our annual review of our direct employees. Those things are the few exceptions where we're allowed to meet outside of public view. And even then, we have to keep minutes of those meetings.
I will do that for the portions that need to be private. Is it possible that
We can take that under consideration. It's one of the, we have had some presentations from the public before and from various nonprofits. So that's an item that the agenda team can look at. So I appreciate the work you're doing, and I appreciate the difficulty it is to and the courage it takes to stand up and talk about that. Any other comments from the board? If not, then we'll move on to emergency business. Is there any emergency business today?
No.
Then we're on to item 5, which is the consent calendar, and these are items that are considered routine by the Board of Commissioners and will be enacted in a single motion in the form listed below. And if there was desire to separately discuss these, they would have been pulled under adjustments to the agenda. So with that, do we have a motion to approve the consent calendar? Commissioner Lyken.
Thank you, Mr. Chair. I'd like to move approval of the consent calendar, and this is for July 31st, 2018.
Second?
Been moved by Commissioner Lyken, seconded by Commissioner Williams to approve the consent calendar. All those in favor, please say aye.
Aye.
Any opposed? Motion passes unanimously. That gets us down to item 6A, which is the first reading and setting the second reading on the public hearing for ordinance number 1807 in the matter of amending Lane Code Chapter 13 to add, revise, delete definitions and provisions to modernize and update the entire chapter, amending Lane Code Chapters 10 and 16 to update references and definitions for consistency with Lane Code Chapter 13 and adopting a severability clause, file number 509 PA 1605453. And we have Lindsay Eichner here.
Good morning, Chair, Commissioners. Today, I'm here to request the approval of the first reading and the setting of the second reading for August 21st at 1:30 p.m. time certain.
Any questions for staff or discussion? If not, I'll entertain a motion. Commissioner Lyken.
Thank you, Mr. Chair. So I'd like to move approval of the first reading and set the second reading and public hearing on ordinance number 1807 for August 8th,
August 20th.
or excuse me, August 21st. I was looking at 8 for August. August 21st, 2018 at 1:30 p.m.
Second?
It's been moved by Commissioner Lyken, seconded by Commissioner Williams, to approve the first reading and setting the second reading and public hearing for August 21st, 1:30 p.m. time certain. Any discussion to the motion? Seeing and hearing none, all those in favor, please say aye.
Aye.
Any opposed? Motion passes unanimously. Thank you, Ms. Eichner,
Thank you.
and thank you for your patience. That moves us on to item 7A, Technology Services, Order 1807-3107, in the matter of approving the purchases of Cerium Corporation Professional Services and Avaya Telephone System Equipment for replacement of the county's telephone system in the amount not to exceed $800,000 and granting authority to the county administrator to execute the contract. And we have Mike Finch, our Director of Technology Services, here.
Good morning, Commissioners. Joining me is Janet Labonte, a Senior Project Manager working in Technology Services and overseeing this project. So yes, I'm here to present to you the purchase of a new phone system for Lane County. In introducing that system, I guess I wanted to take a moment to talk about the mighty phone. I know we're the technology department and technology today is amazing, but the phone, dating back decades, century, is still a vital component of communication today. And I'd like to talk about my extension here at the county, which is 4232. I've had this extension for, I don't know, it's just worked out. I've had it my entire career here, 15 years of answering thousands of calls. And one of the neat things about my extension is that it's one number off of elections. Elections is 4234. And as such, it just so happens, it works out. I get a lot of election calls that come to my extension. And I get the privilege of working with these folks briefly before I realize what they're needing and I hand them off to elections. But I hear stories of folks that have lost their ballot and want to be able to exercise their right to vote, or they've just moved in and want to get registered. And so I hand them off to 4234, knowing that Cheryl Betchart's group's going to come over to elections and make sure that they get what they need and can get elected, can participate in the election. And Extension 3608 is the behavioral health extension, which folks reach out to when they need services from behavioral health. 4191 is veteran services, and 4651 is Lane County permits. behind the strategic plan, which is our one-pager, there's at least one or many phone numbers that this system will carry folks to be able to communicate with the folks, to get the work done, and to drive that forward for our county. And so that's the system we're talking about today. We're replacing an aged-out, decades-old system with, we're proposing a new system, as we mentioned, with Cirium Corporation, professional services, and an Avaya telephone system. The process we used to select the system, we posted an RFP in February, which ran through to early April. We received 8 proposals from that process, and we kicked off the initial round of scoring in April to select 5 finalists from that first round to come and present to us. The 5 finalists came in and presented in May, and we had 3 panels that participated in their presentation. That included a functional presentation and demonstration of the functionality to departments including A&T, the District Attorney's Office, Health and Human Services, Public Works, Sheriff's Office, Technology Services, and Finance. And focusing on functionality that addresses some of the heaviest traffic areas in the county, including clinics, which takes tens of thousands of calls a month. Another panel we had was our admin and billing group to review the financial aspects of the system. So when we bring in a new system, it's got to be able to be tracked and billed out across the county. And then we had a technical design and security review, because phone systems that come in today are like computer systems. They run on a computer network. So we reviewed it from that aspect. Out of that process, each of the teams, the top selection was this system, which is the Avaya system with Cirium Network Professional Services. And in working with the negotiating the contract, we have come forth with an $800,000 not to exceed amount for purchasing the services in the system. Just to talk a little bit about more broadly, the operational costs of this system, we're looking at $70,000 a year for services from Cirium that will support the system, provide a help desk, 24-hour by support for the system, and troubleshooting and maintenance. And then $10,000 a year, really internal staff of just billing and operating and such. So about $80,000 a year for operation of this system internally. There are other cost components to a telecom system, including carrier costs and other such, but I'm just talking about the system. So that's what we're putting forth to you today and requesting your approval in this order. Any questions?
Questions from the board? Commissioner Sorensen.
Well, first of all, is there any urgency to this?
Yes, so our old system is reaching end of equipment life at actually the end of this calendar year. So we're working quite quickly to get the components replaced.
Okay. What, are you open to hearing other ideas? Or do you think that this is kind of a done deal?
Well, I guess we're always open to ideas, but this is.
Yeah. What about issuing everybody a cell phone?
So, cell
And
phones.
I'm putting a list of all of the county-issued cell phones and the people are issued to on the website, and then maybe providing some staff support for all those folks that don't have computers and are going to call an information number, and somebody's going to tell them who to call. Is something like that done in this day and age, or do we really need to spend this kind of money for what I might call a fixed phone system?
So the great thing about this system is it really extends the functionality into embracing mobile technology for those areas that are mobile. But many components of our county actually still heavily depend on a fixed base. Some of the more heavy traffic areas of the system that it supports are places like the clinics, where they receive thousands of calls a week. So we're talking about call queues where calls come in, and sometimes there just aren't enough people to answer them all. So this system is really providing, the core features that support some of those really sophisticated functions to tackle the large traffic areas. Routing calls from one individual to another if someone's unavailable. So ring this phone first, then if that one isn't available, ring the next one, so call progression, and then standing up spontaneous centers for need. You know, we have annual needs for taxation where they have tax questions during a part of the year more prominently than other parts. So that's what this system is really doing beyond what just a single mobile phone would do.
Commissioner Lycan?
Thank you, Mr. Chair. So, Mike, thank you very much for the presentation. Question I have is the $800,000 investment, so it's just kind of a one-time investment. And so how long do you think that this will last, this current infrastructure will last once this investment is made, or if this investment is made? Maybe I should say it that way until we actually vote on it, so.
I mean, this is a larger, longer-term fixed asset that's coming in. The life cycle typically of technology components these days is around 5 years. But the big difference between this and the old style phone systems it's really just software running on your network. And so the components coming in as part of this are more typical network switches and servers, and we're very used to those life cycles. So it'll be a more, I guess, a regular replacement cycle behind it. So it's not going to be necessarily a big purchase in another 10 years.
Great, thank you.
Commissioner Farr?
Thank you, Mr. Chair. Mr. Finch, Ms. Labonte, thank you very much for the presentation. And you know, when did you start working on this? Last week or so? Is that right?
It feels like that sometimes.
It's been some time since you made the presentation, and I'd like to point out, Mr. Mokrahajski, that under robust infrastructure, this really fits directly into our strategic plan in making certain that we have the infrastructure to provide the safety network in Lane County. And as far as just simple communications, the communication system is essential for safety throughout, from one end of the county to the other. And you know, we all carry one of these with us, and always check what we're doing. Does it fit into the strat plan? Well, it does. So very good on that. Second thing is I'd like to mention my phone that I have sitting on my desk, which has about a 20-foot coil cord that really can only stretch no more than about 9 or 12 inches, because you know how they all get bound up. And as I was trying to unbind it the other day, I found Jack Roberts' initials on it. Now, Jack Roberts was a county commissioner sitting in my office about 25 years ago. So that's how long my phone's been there, I think. So this comes at a really good time, because you mentioned that the current equipment is reaching the end of its life cycle. I think mine was probably quite some time ago. And so fortunately, we don't have to use those too frequently. But I'm excited about this. It really is, Mr. Mokrahajski, it's us moving in the right direction to make sure that we're using our equipment, updating it at the right time, maybe sometimes a little late, but to make certain that we are providing the best level of service to the people. You mentioned people queuing, for instance. You know, one of the most frustrating things when you call anybody, particularly a government agency, is you get a menu of different buttons to push, and you have to go through the long, sometimes 2-minute menu before you get to the button you want to push. Well, this allows us, I believe, to move forward more rapidly and make sure that the calls get routed in the right order. So therefore, reducing the frustration of people trying to get a hold of Mr. Mokrahajski, or you, or me, or Commissioner Sorensen. So it's, thank you very much for the work you've put into this. And you've not said very much so far, but I'll bet you've done a lot of work, haven't you? So thanks very much. I'm excited.
So I appreciate bringing this contract forward. You know, our phone systems are beyond just the cell system. When you think about our clinics that have multiple people that do the scheduling, the ability to have those calls queued, so when one of those schedulers gets freed and hits the next person in line, and it comes out, you can't do that with a single cell phone. That person can't answer that. You can't have that system that will do that, put people in the, your call will be answered in the order, that's received. That really does mean something, for folks to understand that, don't hang up, because you'll get, if you hang up and call back, you actually move back in the line. But knowing that our, the folks that are doing scheduling there, or the folks in the tax office, or the folks, up in the permit office in Public Works are, able to answer those calls in a rolling fashion with multiple people answering those calls. Whereas if you start talking about single cell phones, that's just not an available system. But our current system right now, and our current, provider of that system is the Lane Council of Governments. And I understand that they currently own the rights to the exchange that we have, which is the 682, which folks have, over the years, gotten very used to. Everything with the county is 682, and then you mentioned all the extensions. And the folks that, people are used to the sheriff's non-emergency number starting with 682, or the permit number starts with 682 to schedule your, all the contractors know 682 plus 4 digits is where you go to call and schedule a plumbing inspection. So can you talk a little bit about our ability to hold on to the 682 exchange and what might happen if we can't, and as we move forward with a non-LCOG provided system?
Yeah. So good news, with regard to the numbers that we use, the system, is independent of that consideration. So whatever numbers we choose to use, this system will support. With regard to the 682 block specifically, we look forward to continuing to work with LCOG as they manage that block for not only us, but themselves, as well as the city of Eugene, and I believe LTE as well. So it's been a block that's been shared across time, and we'll continue to work and partner with them on what makes the most sense in continuing usage of that block.
Excellent, thank you. Any other questions for staff? If not, I will entertain a motion on the order. Commissioner Lykin.
Thank you, Mr. Chair. I'd like to move approval of Order 1807-3107, the matter of approving the purchases of Cerium Corporation Professional Services and Avaya. Is that how you say it? Okay, Avaya telephone system equipment for replacement of the county's telephone system in the amount of not to exceed $800,000 and granting authority to the county administrator to execute the contract.
Second.
It's been moved by Commissioner Lykin, seconded by Commissioner Williams to approve Order 1807-3107. Discussion to the motion. Seeing and hearing none, I'll call for the vote. All those in favor, please say aye.
Aye.
Any opposed? Motion passes unanimously. Thank you, Mike.
Thank you, Commissioner.
That gets us on to Human Resources. Item 8A, Order 1807-3108, in the matter of establishing new salary ranges for psychiatrist and child psychiatrist classifications. And we have Alana Holmes, our Human Resources Director.
Thank you, Chair Bozovich, Commissioners. Good morning. Alana Holmes, Human Resources Director here at Lane County. With me, I have Human Resource Analyst Darcy Dillon, and Karen Gaffney is in the audience in case she's available to answer questions as needed. So a little bit of an introduction to this. Part of the work that we do in human resources is supporting departments in a variety of professional areas, including recruitments, hiring, and then absolutely once you've gone through that work to find top talent is the retention component. And so when we talk about the areas of psychiatrists and child psychiatrists, that is certainly very relevant in that we have spent a lot of time recruiting top talent, bringing them into the organization, and then when you have really great folks doing important work, wanting to keep them here. And so today we're before you, and we'll be asking the board to approve the creation of new salary ranges for the psychiatrist and child psychiatrist classifications, which will assist the county in the recruitment and retention of these positions in H&HS. So at this point, I'd really like to turn it over to Darcy Dillon, who can talk a little bit more detail about the compensation and the recommendation. Darcy.
Thank you, Commissioners. as Alana was saying, the gist of where this is coming from is really about recruiting and retaining our existing staff. And as an example, 4 out of the 5 current employees were hired at the top step of the ranges, so there really is no more room for us to differentiate between individuals on their experience and education. And having to hire at the top step is indicative of a problem with our system. So what we did and we looked at is our retention as well, and there's only 4 psychiatrists and there's 1 child psychiatrist, so any turnover in those ranks is an extremely high turnover rate for us, so we really can't afford to lose folks in these, and if they don't have anywhere to progress in their salary structure, they could easily be enticed to move elsewhere. What we did, as we've done with other compensation issues, is we did a 5-county comparator analysis. And when we did that, we found that both the psychiatrist and the child psychiatrist classifications were under market. And these were using the same 5-county comparators that we've used for our other groups. Because of that, we are recommending a change in the salary ranges for both of these classifications. And our recommendation would be to take the existing salary range and to drop the bottom 3 steps and add 3 steps to the top. And this would deal with the lack of competitiveness in the entire range as opposed to adding something to just the top. So when we did that, and we did the analysis again against our comparators, we found that that would put us within the market on our range, which is where we would like to be. The budget did costing for this, and that information is included in your packet, so I'm not going to go through that today unless you have questions about it. So at this point, what we're looking for is to see if you have any questions, if we need to provide you any additional information. Otherwise, we're asking that you approve the new ranges that are listed in your packet.
Any questions for staff on this? Commissioner Farr.
And mine's a procedural question, and I'll point it direct toward you, Ms. Mokrzycki. The discussion on this salary range, did discussion on this take place in an executive session which I was recused?
No, it did not, Mr. Chair, because this is a group of non-represented employees. And they're not under a contract. We don't have the ability to have that discussion in executive session.
Thank you.
That's why we're having this, this discussion in open session here at the board.
Thank you.
Further questions? If not, if there's no questions, I'll entertain a motion. Commissioner Lyken.
Thank you, Mr. Chair. So, Mr. Chair, I'd like to move approval of Order 1807-3108 in the matter of establishing new salary ranges for psychiatrists and child psychiatrist classifications.
Second.
It's been moved by Commissioner Lyken, seconded by Commissioner Sorensen. Discussion to the motion. I'd just like to say quickly that, these are really critical positions as we talk about our focus on behavioral health. And, we really need to keep these people, we need to be able to recruit people into these positions. And it does seem like kind of a hefty price tag for just basically, 5 people. A 3-year cost that exceeds $300,000 over those 3 years. But I really, these are critical positions into helping guide our behavioral health staff and help people, as we spent an hour discussing just one aspect of behavioral health this morning in suicide prevention. I believe that this is really critical to maintain these positions, and unfortunately, we've had to kind of hold, set them aside for a while and haven't done a lot as you look at the history of the salaries in these positions. And the fact that we're hiring on the top step is an obvious indicator that we're out of range. So I appreciate the work that Darcy's done in doing the comparisons, and that both Health and Human Services and Human Resources are bringing this forward, because really, really critical positions in all of our efforts around behavioral health, from trying to divert people out of our criminal justice system to suicide prevention to addiction treatment and prevention. It's all ties together, and these are linchpin positions. So thank you. Any other discussion of the motion? Seeing and hearing none, all those in favor, please say aye.
Aye.
Any opposed? Motion passes unanimously. Thank you.
Thank you.
And with that, we'll move on to item 9A, County Administration Announcements.
Thank you, Mr. Chair. I have a few items, but the first and most important is to introduce you to our new Parks Manager. So I want to invite Dan Hurley, our Public Works Director, and Brett Henry, our new Parks Manager. And I'll just say real briefly, and then Dan can get into a little more detail. Brett is, we give you a really low chair here. You might have to adjust that. That's okay. Dan and I are kind of short, so we'll kind of even it out here.
Still taller than y'all, by the way.
Thank you, Commissioner, for that. Where were we? We've been recruiting for this position, did a national recruitment for our Parks Manager position. It's a really important position in our organization, as the board certainly knows, and a lot of transformation happening with our new 20-year Parks Master Plan that has been about a decade in the making, but is nearing completion, and we're really excited about bringing that forward to the board here in the coming months. And Dan can talk about the process that we went through. But Brett comes to us from Yamhill County, Parks Manager in Yamhill County. Now, Yamhill County is pretty nice, but it's not Lane County. And of course, we know there's no place on earth like Lane County. And I don't know about Yamhill, but I don't know any other county that has the crown jewel of Mount Pisgah and Buford Park and Mount Pisgah Arboretum that we have here at, as well as our entire park system. But we're particularly excited about our flagship park there and the opportunities there are to continue to utilize that and other park facilities in the future. So we want to just welcome you here to our organization. And Dan, you want to introduce Brett formally to the board?
Sure. So Brett Henry, we're very excited to have him on board. This has been a hard position to fill, to find somebody that has a breadth of parks experience and management experience, and Brett has both of those. He worked in Louisiana and formed a large natural park there, and then he's been the parks manager at Yamhill County for the last 5 years. So we went through 2 recruitments to try to fill his position. Very excited with where we've landed with Brett. He has experience carrying out a new master plan, which we're going to be in the situation of going through. We'll bring an update to you this fall and hopefully have that approved by the board by December is our goal. So parks, Brett's hit the ground running with our parks meetings. We're hitting 6 community meetings in 2 weeks to bring our draft our Parks Master Plan public review draft out. So he's getting a chance to interface with some of the public and keep that project moving forward. Welcome, Brett.
Well, thank you very much. Yeah, so as Dan said, I have a diverse parks background, ranging from Louisiana, where I managed a couple parks, to a larger park system with Yamhill County, 17, and now 63, so exponentially growing. But I look forward to bringing some more stability to the parks program. As County Administrator mentioned, it's been vacant for roughly 10 months. So I bring kind of a vision of openness, transparency, and public engagement. And so, as Dan said, been kind of thrown into the process with 6 public meetings in 2 weeks. But look forward to going to Lowell Firehouse tonight and engaging with the public and talking about our wonderful park system and our master plan that's coming on board.
We'll be in Lowell tonight, Crestwell tomorrow, and Florence on Thursday. So those are all at 5:30 p.m. for our listeners.
Commissioner Sorensen.
Well, thank you so much for accepting this position, and thanks to the Public Works Director for offering it to you. And I'm glad that you're hitting the ground running with the various meetings. One of the things that I am quite interested in terms of the future of Lane County parks is whether we need to have, kind of zero in on parks function in a sense of public parks and places for people to go to recreate and enjoy the outdoors, as opposed to, and I'm not convinced either way, as opposed to a broader mission of a parks, recreation, and open space agency that certainly people in the parks, open space, and recreation functions have seen the interrelationship between those and the need to get Americans away from their cell phones. By the way, mine's right here. I just don't, like, do as I say, not as I do. But get Americans, particularly the youth and the elderly, that are most susceptible to either being in front of their cell phones or being in front of their televisions, and not getting out and exploring the nature that's around us, and maybe from a public health standpoint, not appreciating and not having the opportunity to appreciate the importance of being outdoors and being away from screens. And, between the five of us, we've got, 10 screens up here right now. So we know that Americans are really using technology, which is great in many ways, but there's also a sort of a nature deficiency that's going on that we need to be aware of. And I don't have a great answer for that because, quite frankly, our Parks Division has a lot of problems in the way it is now, and I'm talking about finances. So the Parks Advisory Committee is sort of my answer to this. This is where we appoint people that can knock these issues around and help you and help Dan and help the county administrator, help the Board of Commissioners with the interrelationships to all these public policy choices we're facing. And I just want to encourage you to stay close to that advisory committee in particular, and also with your great experience in Louisiana and Yamhill County, you know, at least from your Oregon experience, where some of the opportunities for money might be, and that's going to be a big one, but I just want to welcome you.
Well, I appreciate that. And yeah, I understand that we don't have a well-rounded recreation program, but I think one answer to that may be with environmental education and stewardship. The county administrator mentioned Mount Pisgah. There's a lot of opportunity there to expand on some of those educational programs and getting, the kids, the youngsters out to experience nature. So.
Mr. Chair, two additional, I know there are other commissioners, but just appreciate Commissioner Sorensen's comment there. And both on the funding piece, Dan and I met yesterday, and Dan, not surprisingly, gave me a heads up which I knew that as we near the end of the park master plan process, and we're visioning what we want our park system to be over the next 20 years, there's a funding conversation that naturally we're going to have to happen. That's going to have to happen as part of that, because we don't have the resources that we need to maintain the existing assets we have, let alone make investments that we want to make to have the greatest park system possible. So we will need to have that funding conversation. The other thing I want to comment on is yesterday I was at Trillium Behavioral Health, which is a division of Lane County. And one of the questions, rolling out our strategic plan as we're doing in these 24 meetings, one of the questions I got was about our park system. And they said, we feel like parks is such an asset, and particularly Mount Pisgah is part of the reason I brought up Mount Pisgah. And they were coming at it from a behavioral health standpoint, as Commissioner Sorensen was sort of referring to here, that, they're getting people connected to nature is a really important component of both healthy physical activity and healthy mental activity. And can't we do more in terms of promoting that asset and creating that as a resource for individuals throughout our community, particularly those who might be dealing with mental health or substance abuse or youth in education programs. And so I think there are some great opportunities there, and certainly that's an example of it is the crown jewel of our park system, and it is largely successful because of volunteers, because of the Friends of Buford Park and the Mount Pisgah Arboretum and the Nature Conservancy that operate there. So some great food for thought and opportunities for the future.
Commissioner Williams?
Thank you, Mr. Chair. Well, between Commissioner Sorensen and Mr. Mokrzycki, they stole most of my talking points, but they did leave me with a little bit, and that is Mount Pisgah and the Buford Park are in East Lane County. That's the district I represent, so never hesitate to call me if you have a question or a concern. More than happy to help. But you do, the volunteer component, you do have some really wonderful people that have adopted the parks for a lot of great vegetation enhancements. It's just incredible work that's happening at Mount Pisgah. So you will find a small army of volunteers out there that just do really wonderful restoration work and vegetation mitigation, blackberries primarily. Don't know if you have much of those in Yam Hill. We have lots of blackberries.
Lots
So,
of Yam Hill as well.
Yeah.
Down south is kudzu and other invasives, but yeah, they're everywhere.
well, they're a constant source of pain and contention, but we deal with them. But you have great people out there that will help you in your endeavors. And again, never hesitate to give me a call if you need some direction or some help, introductions, any of that.
Appreciate that.
I'm there.
Thank you.
Commissioner Farr.
Thank you, Mr. Chair. Welcome from Yam Hill County. You know, I love Yam Hill County because my family farm that I grew up on in Tillamook County was on the Trask River. And we all know that the middle fork of the north fork of the Trask originates in Yam Hill County. So your water flows past my front door. Love it. So thank you for keeping that clean. But significantly, you said, you know, there are 17 county parks in Yam Hill County. You have more than 17 boat ramps and marinas alone in this county. So you got to be particularly excited about the work here. And as Commissioner Sorensen and others have noted, we have a very robust, hard-working advisory committee that's tackled some very big issues over the last few years. And you're coming in at a very good time to really generate a solid direction for the future of Lane County Parks. Welcome.
Thank you very much.
And thanks for the fresh water.
Brett, welcome, and it was great to see you on your second day in the hot community center at Veneta that didn't have any air conditioning on one of the hottest days of the year.
Well, that's nothing compared to Louisiana with the humidity there.
Yeah. I'm an East Coast transplant, so yeah, when people talk about hot here, I just kind of shake my head. But it's amazing how fast you acclimate, because I was having trouble on a bike ride Sunday with the heat. So, one of the things, yes, people are on screens and kids are on screens a lot, but tech can also bring people out in the parks and out to recreate. One of the things on my phone that comes along with me when I ride, like I did on Sunday, is Strava and Map My Ride and other apps like that actually get people out. And when you think about some of the future of our park system, it's dependent on tech too. People don't call and make a reservation at one of our campsites. They go online to do it. So having that connection in tech with our parks is going to be important, and how we leverage that to get people to be more active and utilize our parks and keep our parks connected. And even now it's credit card machines for parking, paying for parking, not cash machines or the little box that you slip the $5 bill in the envelope into, because those are kind of not too, so those little pieces of tech. And then, I know we are truly a parks department. We're not a recs department. We just don't have the ANRECs part that most places do. But we supply the opportunity for that ANREC. And the ANREC happens with friends of. We see a lot of our programs, and not necessarily just friends of. We see it like with Perkins Peninsula with the Babe Ruth folks that utilize Perkins, with the various clubs, et cetera, that do everything from disc golf to, holding some of the events out on Fern Ridge, the Thursday night sailing races and all that the Eugene Lock Club, which is next door to the Richardson Marina, runs, but half the boats that race it are moored at Richardson. So and that those other entities that we have to partner with because we don't have the ANRAC, and developing those relationships. And I think the master plan talks quite a bit about developing the friends of type relationships. It may not always be named friends of. It may be, the Fern Ridge Babe Ruth folks, or it might be some other entity. But I think that's a really important thing that we need to leverage as we move forward. Remind me later, I promised, when Vigo Toftmark talked to me, I met with him last week about the park that he purchased from Blatchley Lane, kind of just to protect it up there in Triangle Lake, that he'd love us to take on at some point, like we took on the Archie Knowles campground. But I told him, I said, Brett's only been here 3 days, Vigo. Let me give him a little time to settle in, and then I'll bring it up. But just remind me to talk to you about Triangle Lake Park sometime. It's an opportunity, 17 space campground, already has well and septic involved. The only issue is, whether there might be, how close it is to the rock slide and some of the liabilities there. It's a future possibility for us, and we tend to make money off of campgrounds versus some of our other facilities where they tend to be non-revenue generating. So opportunity maybe to think about. But on your now 7th day, yep, we'll hold that conversation for a little bit later. Maybe as we're developing the master plan, think about, we already are having difficulty funding our deferred maintenance on our current parks inventory. To consider an addition, we have to do that carefully. So, and I let Vigo understands that, I think. So, but I promise we'll probably have future conversations around that park, and really appreciate that you're here. And we have that now permanent leadership in our Parks Department, some great folks there. I forwarded a voicemail to Dan last week or the week before from somebody that called me out of the blue just to tell me what a wonderful job our parks maintenance people do with bathrooms compared to some of the other agencies in the area, and just how much he appreciates the work of our parks maintenance folks. Just, so it was really great to get that unsolicited, attaboy from a citizen just about, the difference between how well our, bathrooms are maintained versus maybe some other agencies. And I just thought it was really nice. So you've got some great staff that are already dedicated and hardworking to work with. So look forward to seeing you Thursday night.
All right, thank you. I appreciate that.
Great.
All right.
Thanks.
Okay, Mr. Chair, just a couple other brief items. First, this Friday is Lane County and the City of Eugene are co-hosting the First Friday Communities of Color networking event. It'll be at 5:30, from 5:30 to 7 p.m. at the Campbell Community Center, which is at 155 High Street. So 5:30 p.m. there's going to be music, food, family-friendly kids games and things. I'm going to bring my 6-year-old daughter. She's excited, hopefully, to have some barbecue and get her face painted. So I'd invite the commissioners and anyone else who's available and interested to join us as we continue our equity work and connecting with our partners in the community at 5:30 this Friday at the Campbell Community Center. I also want to share with the board, if you haven't received this already, we have our new budget in brief. Threefold flyers. This is for the current year's adopted budget, and it just talks about, where the money comes from that Lane County receives, where your property tax dollar goes, where the revenue we receive goes, how we're spending those resources, our 32 funds that we have, some of the challenges that we faced and some of our strategic initiatives in this budget are on the PERS side account and the housing improvement plan, public safety, and infrastructure in other areas. So a great, easy read for residents and interested community members to have. And finally, I want to, on Friday, yesterday I mentioned I was at Trillium Behavioral Health. On Friday, I was at our behavioral health division on MLK Boulevard and presenting to the great staff there. And I wanted to just share some comments that they shared with me about the incredible improvement in access to care that we've achieved in our behavioral health division. As you know, over the last 4 years, we've been in the process of transforming the model of care there to this Denver-based model of care, really focused on access, making sure that so many individuals will show up at our behavioral health facility and seek care that day, and we didn't have the ability to provide them access, and they'd be turned away. In the last 2 months alone, in May of this year, the individuals who sought care, there were 94% of the individuals who sought care received care. In June, 96% of the individuals who sought care received care. We've seen 100 new clients, at least 100 new clients have been seen in the past year alone. And it's just been a huge increase really in the last several years as we've changed that model. You have those peer support specialists that are working with clients as they come in the door. There's more of a team-based care, so as opposed to this segmented treatment process, there are teams of individuals who are all working together to make sure that individuals receive the care that they need when they need it. And so a huge impact on access for our clients and a huge impact on support and morale for staff themselves. The staff talked about how great it is to work on a team. So as a psychiatrist or a behavioral health specialist or an office assistant, you're not sort of on your own dealing with really challenging clientele. They have their own peer support, right, for the challenges that they have to face as staff dealing with really tough issues. So I just wanted to share that with the board. It was very invigorating to engage with the staff in behavioral health, given all the challenges that they face, but the wonderful work they've done to implement this new model of care and the great results that they're starting to see from that. I also wanted to note that as you heard on the psychiatrist conversation earlier about recruitment and retention, and you're going to hear a presentation when our new performance auditor completes the recruitment and retention audit that is being worked on. Another question I've received at Behavioral Health and our Trillium Behavioral Health yesterday was around that audit and just how is recruitment and retention. And I made the comment, as I think we've shared with the board, that we've really started to dig into as part of this audit work, dig into how we're doing with recruitment and retention. And we've faced, in the past 7 years, we've averaged around 11 to 12% turnover in Lane County. The highest year we've had in 7 years was 2012 at 19%. Not a surprise because we had a lot of cuts, right? In that huge decline, the Secure Rural Schools program, huge drop in funding there. And so we had a lot of layoffs and retirements that happened. Since 2012, really in 2000, when you look at 2014 through 17, we've averaged around 11, 12%. Last year, we had a little bit higher with a number of retirements. As the economy's gotten better, we've seen more retirements happen. This year, we're on track halfway through the fiscal year, or through the calendar year, rather. We're at about 4%. So we're trending at a historic low turnover rate. And when you compare that to the national average for state and local governments, we are, other than that 2012 year where we were higher than the national average, we've been consistently below, where the national average for state and local governments was around 15% and then was 17% last year. We've been below that significantly. And you've seen the national average has actually creeped up because as the economy gets better, turnover increases in the public sector because there are more unemployment goes down, more jobs available. Public sector tends to have more turnover when the economy is good. When the economy drops, there tends to be less turnover in the public sector. We've actually trended significantly below that national average, and particularly in this current fiscal year. So some positive signs there. Certainly some work we need to do in pockets of areas around healthcare providers and some very difficult to recruit positions, but on average, I think some positive signs there. That's all I have. Thanks for letting me chew up some of the morning here with announcements, Mr. Chair.
No problem. Any other questions for the administrator on this? Commissioner Lycan.
Thank you, Mr. Chair. So, Steve, I forwarded you a voicemail I received from a constituent. I just wanted to make sure you got that. I don't know if anybody else is receiving them, but I'm receiving voicemails regarding the Janus decision, and I'm forwarding on to the county administrator or human resources director because that's out of our out of our bailiwick. So I forwarded that to you yesterday, and I just want to make sure you received it because I'm not going to respond back. So I don't think it's appropriate for me to respond back, especially when that directly deals with employees at Lane County and not under our jurisdiction as commissioners. That's all.
Thank you. And just real briefly on that, Commissioner Lycan and Commissioners, we have been working collaboratively with our 8 bargaining units in Lane County. On that, we, in terms of the communication front with employees and making sure that employees are aware of that change based on the Supreme Court's decision, but that the bargaining units have the ability to communicate directly with that. And obviously there's some payroll implications, and all of that is, I think it's the feedback we've received from our unions has been really positive in terms of the county's role in helping to make sure that employees have factual and objective information.
Thank you.
Thank you. So with that, we'll move on to county council announcements. We do not have an executive session today for the first time in a while. And I don't believe there are any other announcements out of county council. So that moves us to commissioners' business announcements, announcements from the commissioners. We probably covered it under remonstrance today. Agenda team request or work session request from the commissioners.
Mr. Chair, I kind of heard buzz around a couple of them. One was the regarding the letter that we were sent by the DPLC regarding supporting the art museum, and wondering if there's any discussion we want to have regarding supporting this letter. And part of that discussion would be where does that fit in with the Lane County Historical Museum, which we do have jurisdiction.
Yeah, maybe we could have a report back from the Historical Museum and from Mr. Ross, and have them come in and tell us about their different ideas for the Eugene Post Office.
Or how they could be joined.
Yeah.
And the second one, at some point, maybe I'm not sure exactly how to frame the request regarding further work on the suicide prevention issue surrounding both Ms. Wilson's ask and further work on Mr. Brubaker's. Once again, I don't have a question. I don't have a wording on how to ask for that at this point in time, but that may come up in the next few weeks.
I think
I heard the board request that we come back with quarterly or semi-annual updates on suicide prevention, and then certainly the request for individual meetings is out there for commissioners to take on. In terms of the, what I heard was both the support letter, the potential of a support letter, as well as a work session with the Historic Society and this Municipal Art Museum group. If you, I don't know if you want to have that together, or you ask us to pull together some information and share that with you, and then you can consider a support letter.
Well, I guess I would chime in and just say that I think that both groups have talked to me about their ideas for the future of the post office in downtown Eugene. And I think that greater communication would occur if both groups were invited in to, and just on an informational level, tell the board what they're planning to do, and, you know, and at that point, it would just be informational. So I don't think it's something staff needs to do. Staff doesn't need to go out and make a presentation. I think what staff needs to do is help us get the two groups here. And if there's a third group that I'm not aware of, the third group, but so that we can learn more about it.
I support that. We have a rich history here in Lane County, both with art and historical, and having the two talk to us together at some point would be good, because the Historical Museum is at a junction right now as to what their future actually is going to be, and a lot of people believe there's a bright future for a larger facility for our Lane County Historical Museum.
So any other agenda team requests besides, Matt, it sounded like there was going to be something possibly coming back out of the suicide strategies anyway, for us to prevention strategies, and then also to do something with the Eugene Municipal Art Museum versus the Lane County Historic Museum, and the post office discussion in a future agenda item. I think agenda team will work on trying to get that set up. Any other agenda team requests or work session requests? Then we're at review of assignments, Mr. Mokrahysky.
Just those two is what I had, was the request for an informational discussion regarding the plans for the post office downtown, in downtown Eugene. And then we'll just add an item, and we can talk with the agenda team about whether it's and public health about semi-annual or quarter, I think semi-annually, doing an update on suicide prevention.
Excellent. Any other assignments that were missed?
Mr. Chair,
Commissioner Liking?
real quickly, so in the post office, if memory serves me correct, that was on the United Front several years ago. So you may want to just also follow up with Alex Kyler on that as well, because I think that was part of the United Front. It's been, I don't know how long, several years ago, but it's been floating around, that idea. So just wanted to bring that up. Thank you, Mr. Chair.
So with that, is there any other business for the board? I want to note for the public that we are down for the next 2 weeks for various reasons, and we will be back in regular session on Tuesday, August 21st will be our next regular board meeting. In between, there are several things going on, including I think there's going to be a public health systems assessment going on, and Chief Justice coming to visit us, and a few other things. So it's not like we're on vacation. We're just not having regular board meetings. So with that, then we are adjourned for today.